Welcome to the Learning Pines YouTube. We hope this video helps.
You start by getting a professional baseline. This is essential. Make an appointment with an optometrist or ophthalmologist who will perform a refraction, corneal mapping, and measure axial length so you know the cause and degree of nearsightedness. Once done, compare current glasses or contact prescriptions to the new findings and set clear goals. Do you want temporary correction, slowdown of progression, or permanent change later? Make sure to bring prior eyewear and relevant health history so the plan begins on accurate data. Now you pick and begin the chosen method. The how matters. For immediate function, use correctly prescribed glasses or daily wear contacts. They restore focus safely. If the goal is slowing progression, discuss orthocratology, night lenses, or low-dose atropine with your clinician and understand risks and follow-up. At the same time, change daily habits. Get 90+ minutes outdoors when possible. Use the 20-20-20 rule for near work. And reduce continuous screen time, so biological drivers of myopia are addressed alongside. Finish by implementing and monitoring the plan. Consistency wins. Wear lenses and use drops exactly as instructed. Keep appointments every 3 to 12 months to track refraction and axial length, and adjust treatment when progression is detected. If you plan surgery, wait until prescription is stable for at least a year. Discuss risks and alternatives. If vision blurs, irritation increases, or you see redness or discharge, stop use and call your eye care provider right away. Infection or poor fit is the common culprit.
Thanks for watching. Consider subscribing if we helped you.